disease in schools. Can everyone hear me?
Yes, we can hear you.
Okay, great. So this is a guideline overview for the Maryland School Health Services Guideline on sickle cell disease. And before we get started, we're going to do a little bit of a roll call because we have some people with the first name names and some people didn't sign in their last name. If you call your name, if you can just tell us your full name. So Melissa King from King County, correct, Melissa?
That's correct.
Janice Howell?
Yes.
Jennifer Jones? Kathy Frost? Kathy Fresh? Kathy Weir? Megan Brookler? Steph Megan? Everyone, I think you all have your phones muted. Stephanie Norman? Yvonne Coleman?
Yes, I'm here.
Thank you. Yes. Kristen Salter?
Yes, here.
Thank you. Janice Steffi?
Yes.
Mary Masuda?
Yes, I'm here.
Carrie Wagman?
Yeah, Wagman, yeah, I'm here. Thanks.
Wagman. Tina?
Yep. Tina Bach here.
Melissa Evans?
That's Melissa King.
That's Melissa King. Thank you, Melissa. Karen Bates?
Yes, I'm here.
Hey, Karen. And then someone else in we don't have a last name. Anyone named Jennifer that we didn't call? And anyone on the line that we didn't
Jennifer Waters.
Jennifer Waters. Thank you, Jennifer.
You're welcome.
Anybody else who's online that we didn't call?
Yes. Brooke Durr.
Brooke. Thank you, Brooke.
And Joy Richards.
Thank you. Brooke, what was your last name?
Durr. D-E-R-R.
D-E-R-R. Okay. And Joy Richards. Great. Thank you so much.
Okay. Thank you.
All right. Well, good morning again. My name is Alicia Medu, and I'm the Health Services Specialist here at the Maryland State Department of Education. And I have some other colleagues here that I'd like to introduce themselves. We'll start with JT because he's helping us.
Good morning, everybody. My real name is John Turner. I help support home instruction, home and hospital, and school counseling programs along with the Title IV grant here at MSD, and I have the great pleasure of also working alongside Alicia.
He's our producer. Hi, this is Lynn Miller. Many of you know me. I work with Alicia and JT, and we're pleased to get this sickle cell disease management guidelines cooking and shaking. So thanks for tuning in today. And I'd also like to introduce Camilla Dacom. She worked with us this summer as a graduate student from Stevenson University. And I'd like for Camilla to introduce herself.
Good morning, everyone. My name is Camilla Dagum. Some of you may know me. I am a school nurse with Howard County Public Schools, finishing my master's with NSU.
Thank you. And so Camilla and I will be presenting this information to you today. We'd also like to ask if you have any questions, if you can write them down and take questions at the end of the webinar. So let's move on. So, as you know, the Annotated Code of Maryland Education Article 7-401 mandates school health programs in Maryland public schools. And as a joint effort between the Maryland State Department of Education and the Maryland Department of Health, we are mandated to develop public standards and guidelines. Now, the recently enacted Annotated Code of Maryland Education Article 7-444 is the law that requires these guidelines for the administration of health care services for students with sickle cell disease. And we will also go on to the next slide. The purpose of this presentation is to provide background on sickle cell disease. We will, within this presentation, we will distinguish the terms that are associated with sickle cell. We will provide a brief pathophysiology of the disease. We will also discuss triggers and susceptibilities related to sickle cell disease, as well as the signs and symptoms presented. Additionally, we'll talk about the effective clinical management of the sickle cell disease, specifically nursing assessment of the student's needs, as well as nursing care plan considerations. And finally, we will talk about the implementation of the 504 and case management, the roles and responsibilities of the school nurse and other school staff, as well as educational considerations.
Okay, so one point of common confusion is understanding the difference between sickle cell trait versus sickle cell disease. Because it's a genetically inherited disorder, manifestation of the disease requires 2 sickle cell genes, one from each parent. So a person who is said to have sickle cell trait may be a carrier of only one of the sickle cell genes. This person may not develop any symptoms of the disease. However, they may have children who develop the disease if both parents are carriers of the gene. Now, outside of the symptoms of an acute crisis, which we're going to get into in a later slide, there are no external indicators of sickle cell disease. Most diagnoses are made in the first month of life. There is a notably higher prevalence of sickle cell gene in those with African lineage, and people of Caribbean, Mediterranean, Hispanic, and Asian descent are also showing higher rates of the genetic trait. The bottom line is there's no way to tell if a person has sickle cell disease by looking at them. And this is why it's so important to stress the use of medical ID accessories of some kind. Okay, so we're just going to go over this slide briefly of pathophysiology. You can see it's an inherited blood disorder that affects the hemoglobin protein on the red cell, causing it to form into that crescent or sickle-like shape. And these normally shaped cells will not pass through small capillary beds effectively, so they'll subsequently cause vessel occlusion. Now, there's several varieties of sickle cell disease. The severity of each type may manifest differently. Vaso-occlusive crisis, or VOC, is a hallmark cause of a sickle cell crisis. VOC will occur in any part of the body and will cause severe pain, swelling, and often fever. As noted in the slide image, any area of the body which may require the perfusion of blood through vessels of smaller diameter, such as capillary beds, is at risk of developing VOC. And this may occur in any area of the body, such as peripheral extremities or any organ like the brain, heart, or lungs. Okay, so in a general sense, any internal or external condition that impacts blood flow, like hydration, temperature, and blood pressure, may contribute to the pain or vaso-occlusive crisis or episode. Any sudden changes in temperature and or prolonged exposure to cold, hydration, and keep in mind hydration is affected not only by water intake, but by temperature, altitude, caffeine, and alcohol. Physical activity, prolonged standing, sitting, or extreme levels of exercise that may shunt blood flow to a specific area of the body. Stress creates increases in blood pressure, so you have to consider that, as well as illness and infection, which creates changes in vascular structure, blood production, and alters the body's temperature. So some of the signs and symptoms of the disease usually are indicative of an active crisis and have to be acted upon immediately. So pain is frequently the more common symptom of the disease. Pain is most indicative of a vaso-occlusive crisis, and it could be anywhere in the body or everywhere in the body. It comes on suddenly, and it may last for weeks at a time. So don't overlook headaches either, as they are a common ailment among students. Fever. Sickle cell disease increases the susceptibility to infection, therefore fever, no matter how slight, should be addressed immediately. And the respiratory system, shortness of breath, asthma, pneumonia, chronic cough, vaso-occlusive crisis in the chest is also known as acute chest syndrome. Also, neurologic changes, including visual disturbances, extremity weakness, and just think of your stroke symptoms and you'll have it down. There are also circulatory changes that include peripheral joint swelling and or skin discoloration. If you think of injuries on the right round, you'll know what I mean. Okay, we'll go into management of the disease. We'll start with our nursing baseline assessment. Now, we have the Maryland State School Health Services Guidelines for the nursing appraisal and assessment of students with special health needs, and this permits the nurse to establish a baseline health assessment as well as identify the vulnerability of any potential triggers. So you want to focus your baseline assessment on history of previous crises, the frequency, the duration, and the location. If there are previous locations known, establish a baseline assessment. For example, if a student has a history of having had acute chest syndrome, you really want to clearly document the lung sounds to capture any variations from previous scarring. Normal temperature, and this is something that has to be discussed with the parent and the physician, because a normal temperature for some may be an elevation for others. Remember, normal hormonal shifts will also cause fluctuations in body temperatures. You want to ensure there's a recent eye exam for the student and their vaccine followed. You also want to discuss pain tolerance, because this is important information for a parent to share, because children can express pain in different ways. Remember, sickle cell crisis may start as subtle changes to the baseline, and these may not be obvious to a clinician who does not routinely see sickle cell children. So having a documented baseline is your one tool toward ensuring that the student gets the appropriate level of care for their condition. Continuing your baseline assessment, you want to do a complete environmental assessment, and this should be done every year, as well as whenever the student's circumstances or health change. You want to look at the classroom location and look at the year-round environment in that classroom as the temperatures change in the room. Consider the reality of the resources. Does the student have to walk to a portable classroom? Is there adequate heating and cooling? You want to look at the student's schedule for if you feel like they're changing classes, when their physical education classes, the time of the year, and the frequency. Look at their activity plan, such as the student participating in any after-school activities. Or field trips are a biggie. Planning an extended field trip, you want to look at weather, the location of the trip, and the proximity to medical care are all considerations to make when you're looking at field trips. So let's look at our nursing diagnosis. Now, NANDA International suggests the following nursing diagnosis. So let's just touch on them briefly. The risk for ineffective tissue perfusion, that would be caused by the vaso-occlusive crisis. The risk for altered cardiovascular tissue perfusion is pretty much the same. You have your activity intolerance, and this again, think of the claudication and the temperature intolerances. Risk for injury, think of swelling to localized extremities. Chronic pain and acute pain, this is also the result of the vaso-occlusive crisis, and it may take a long time for this to resolve, so you may be managing their pain in classrooms. You want to look at fatigue and their level of ability, especially the schedule and walking around the building. For peripheral neurovascular dysfunction, you want to consider neuropathies as well as motor issues. Impaired sensory perception may be the result of neurologic impairment from a previous vaso-occlusive crisis or stroke. And they have the potential for impaired social interaction. And this is from the long-term absences from school due to pain episodes. So you're also looking at their psychosocial needs. Okay, so what's the difference between the individualized health care plan and the emergency health care plan and the individualized education plan or the 504 accommodation plan? So there are a lot of different pieces we're looking at here. So let's start with the health care plan. They are written by the nurse. They may involve a collaboration with a physician and a parent. But this isn't always required because the nurse can write one if they don't get cooperation. It's focused on the health care of the student only. It provides for care continuity in the health room of the current school. Technically, it's not required to be transferable to another school because each nurse at each school should write them independently. There is no academic assurances with a health care plan or protection. A 504 accommodation plan is developed and approved in collaboration with teachers, counselors, the administrator, the nurse, and the parent. It's focused on protecting the academic rights of the student. It transfers with the student. The student's eligibility is expected to be accepted by other school systems. It includes and references the individualized healthcare plan as a source for healthcare intervention. And note this graphic doesn't reflect all of the 504 accommodations that an IEP or 504 may have, but it will do, it merely just represents the differences between the two documents. Yeah, you can
And this is Alicia. I'd like to interject for a moment. With the individualized health care plan, as many of you are aware, it's a plan that's written by the nurse and it's from nurse to nurse. And the emergency care plan is written by the nurse, and Camilla's going to go into that. But I just wanted to explain that. Thank you.
So this next slide just kind of helps give you a visual of what all of these things do and how they work with the student. So it's just kind of helpful to see the relationship. You can see how the 504 and IEP, the health care plan, and the emergency care plan work together. The individualized health care plan, or IHP, and the emergency care plan, which is the next layer, ECP, can be updated independently of the 504. The 504 meeting is not necessary to change those two plans in order to update the student's plan of care. The 504 and IEP levels may refer to the individualized health care plan within the accommodations, but it does not need to directly stipulate the content of the individualized health care plan. The individualized health care plan is a tool that's used to supplement the 504, not stand in place of it. So these supports are layered because the students that may have an individualized health care plan may not require a emergency care plan or a 504. And we're going to get into this in greater detail in the next slide. So let's move on. Okay, so we'll start with that individualized health care plan. It's for the student, and it's driven by the nursing appraisal and assessment of the students with special health needs. It's developed and written by the school nurse in collaboration with the student's primary care physician and their parents. It's performed no less than annually. It's updated whenever the plan of care changes, and it may be updated independently of the 504, so you don't need to hold a meeting in order to change the care plan. It's just a supplement and not to stand in place of the 504. Okay, so we'll move on to the next slide and continue. The individualized health care plan is used in the health room of the school. It is not shared with teachers or non-health care staff. It identifies the responsibilities of each group involved in the healthcare aspect of the student. This would be the nurse, the physician, the school health assistant, the parent. It outlines the parameters for information exchange, who, what, and when of the information that will be shared with staff. And note the difference to a 504 or IEP, the healthcare plan, again, is updated whenever the condition changes. It's up to the nurse who writes the plan to be able to recognize when they're updating the plan that a 504 review may be needed. Okay, the next layer, the emergency care plan. So this is written with the input from the parents and sometimes the students. It is shared with the teachers, the administrators, the bus drivers, and just anyone who has regular direct contact with the student. You don't want to forget to include the school-sponsored activities after regular school hours as well, like aftercare or other sports events. It contains the emergency contact information, the signs and symptoms of a crisis, a list of the emergency medications, and what to do in the event of a crisis or a disaster such as shelter-in-place or lockdown. Okay. So these are some of the considerations of the information that you may put into both the individualized health care plan and the emergency care plan. A list of known triggers that causes pain, signs and symptoms of stress or crisis, and I've reviewed some of these previously. A baseline temperature range that's agreed to by the physician, and this includes instructions on when to call the parents. Pain management protocol, and that might include ordered medications. That's the part you usually leave on the individualized health care plan for the health room staff. If the student is able to communicate their level of pain appropriately, or how they may communicate their level of pain, is something you want to keep on this plan. The classroom procedures and teachers' concerns You want to provide specific instructions on when and how to send the student to the health room or to call the nurse. And consider the building layout, the access to health, and the staffing of the classrooms when you're writing that plan. You want to be realistic. Okay, implementation and evaluation. You have to provide training to all staff at the beginning of the school year, and this will be discussed in further detail in a later part of the presentation. But you need to identify the staff that need to know which specific student has sickle cell disease. And this is anyone, again, who has regular direct contact with the student. Your evaluation piece is ongoing, and it's dependent on the student's state of health. So, again, you modify the health care plan and the emergency care plans as you need to throughout the year without a 504 meeting, in keeping with the student's physical and educational needs. Things change as the year rolls forward, obviously. Okay, so we're going to just start diving into Section 504 and the IEP's roles and responsibilities. So whether or not the school nurse is the person who serves as the formal 504 case manager, that person is the coordinator for the health care and advocacy of the student in the school setting. You have to be the liaison between the student's healthcare team and the school system staff. And this includes the teachers, the school administrators, food service, again, bus drivers, student services, and the parents. This requires an understanding of everyone's responsibilities of the student's team. That will be described next, the parents, guardians, students, and the staff. Unfortunately, the Maryland Education Code 7-426 Guidelines for Student Emergency Care outlines the following responsibilities for each role group in the student's care. And these are also located in the guidelines if you have any questions about these parts of the slide. The parent-guardian responsibilities. First of all, the parent needs to notify the school nurse or the appropriate school personnel that there is a student with sickle cell. And this is not limited to just having them report the condition, but also it's expected that the parent will keep the health and staff informed of any day-to-day changes or issues to the student's state of health. Are they having pain? Do they have a headache? Were they recently at the doctor and has anything changed? Provide the appropriate medication and or consent to administer medication. They're to provide devices of condition indication, which is supposed to mean medical or recorded slips, some way of identifying the student even outside of school as having sickle cell disease. They also need to provide annual physical and eye exam information from the primary care provider so that you can, again, maintain your nursing assessment. And also, it's go without saying, but I'll say it, updated contact information. And this helps increase the collaboration between the school nurse and the parent. So the student. The student's responsibility includes keeping staff informed of any changes to his or her health. And this is a daily responsibility. So this could look as simple as the student coming in to see the nurse at the first signs of symptoms. It's expected that this is a skill that will develop with the student over time. You want to teach them, and you want them to be able to act responsibly with regard to their sickle cell disease. That's their second responsibility, and it includes avoiding risky situations in which they know they'll cause a trigger. And you want to have them collaborate on their plan of care as much as possible. And this culminates on self-advocacy and personal involvement to the level in which they're able, whatever age appropriate. School administrators, you want them to recognize and support the school nurse, and that includes providing that venue for training of all staff on sickle cell disease. You're going to need their backup to adhere to the emergency care plan during applicable school-sponsored after-school events, especially, and also have their support regarding adherence by the parent or guardian of their responsibilities. Okay, so additional school staff responsibility. The guideline, again, will stipulate multiple responsibilities within each role, like bus driver, coaches, teachers, food service staff, and counselors, to name a few. But the main point of each of these responsibilities is that those staff members read and follow the emergency care plan as it was written by the nurse. We want to ensure the emergency care plan identifies a way for staff to reach the nurse with any questions or concerns. There are a few groups on the right that has some additional responsibilities. That would be school guidance counselors, pupil personnel workers are going to need to assist with educational planning and coordinating how hospital if necessary and offer social emotional support for a student. Like I said, they may have extended absences, they may need help getting caught up in work, and they may have some difficulty with socialization because of their disease. There also may be some transportation needs. So school-wide staff education on sickle cell disease is a requirement. The guidelines will stipulate basic educational objectives that should be covered, and these may be expanded upon. I believe we have a tool to help with that. You want to highlight the importance of planning school field trips and activities when you're doing this training, because many staff that don't do direct care with that student may end up planning a field trip that that student will be attending. So you want to stress this with them, that they need to consult with you about those field trips, and I know they don't. Okay, education and planning. So the next slide is review some of the considerations that we want to make when we are planning our 504 or IEP meeting. And that would be these above considerations, such as education, field trips, and the like that I've already mentioned. The first 3 to 4 items you can see are they can be impacted by weather and the environment. And then the last 2, there needs to be some considerations, again, for that inevitable crisis that may keep the student out of school for prolonged periods of time. Okay, so these are some suggested accommodations to include on the 504. Again, they are just suggestions, but they're things to consider as best practice. So access to water, unrestricted bathrooms, extended time at work, extra books at home, and then considering concurrent intermittent home and hospital. Again, these are just suggestions, but they are something you want to think about when you're planning that 504. And turning the rest over to you.
Thank you, Camilla. That was a very excellent presentation and summary of sickle cell disease. I'd like to talk about evaluation and monitoring students with sickle cell disease. So the care and management of a student with sickle cell disease should receive ongoing evaluation and monitoring by the school nurse for changes to the student's condition and or their plan's effectiveness. This is to be a minimum of annually, but also whenever the student's health circumstances change. So you want to make sure that you're evaluating on a continuous basis. Again, the nurse determines if changes need to be made to the health plan and or the 504 plan. As far as monitoring, you want to be sure that you are training new staff during the year and also training existing staff at the beginning of the year and throughout the year if there are changes in the student status. Classroom monitoring as far as the environment, which Camilla alluded to earlier, may change with the season, so you want to be aware of that, how the warm or cold weather may affect a student with sickle cell disease. And as well, you want to monitor prolonged absences from school or class. So final remarks. We just want to say that this presentation serves as the technical assistance and guidance from the MSDE and the MDH to local school health services programs for implementation of the guidelines. The guidelines are available on our website and under Management of Sickle Cell Disease. And also, it is intended that these guidelines will be used by the local school systems in developing the local school health services policies and procedures as a means to assist the local school health services programs in providing safe and consistent care to the students of Maryland Public Schools. Specific laws and regulations that direct school nursing practice or other health services are identified in the guidelines. And finally, each local school health services program will be required to report on the local implementation of the sickle cell disease management guidelines within their respective school settings. And so we expect that this education around sickle cell disease will be provided at the local level to your teachers, to your school staff, whoever needs to know about students with sickle cell disease. And then we will follow up with you later in regards to the implementation and providing a written notice to us about the implementation of these guidelines. So we're now ready to take questions, and thank you for your time today. So does anyone have any questions? If you do, you can unmute your phones and we will respond. Any questions? Any comments about the presentation? Okay, while we're waiting for questions, I do want to mention that in the sickle cell disease guidelines, there are, at the end of the guideline, there are a lot of references. And specifically, I wanted to mention our colleagues at the Kennedy Krieger Institute, Barbara Ops and Megan Rosner, who works with the Specialized Health Needs Interagency Collaboration. And they have developed a management of sickle cell disease in the educational setting. The PowerPoint is specific to school nurses. And so that's available as a reference within our guideline, but also available on the SNCC website. Additionally, there's also an emergency care plan that was developed by the SNCC program as well, which you are welcome to use that at your local level if you choose to do so. And it's written in such a way that it can be used with the authorized providers to write special instructions or orders for students with sickle cell disease. So, do you have any questions from the audience?
I think you folks did a great job.
Thank you.
Well, I have a question, Alicia.
Sure. Can you state your name, please?
Yes, this is Melissa King. I just wanted to ask about the education piece. In two places in the PowerPoint, I understood that we are supposed to make sure those who will have contact with the student of sickle cell will need to be educated. But there was one place in the PowerPoint which mentioned field trips, which seemed to suggest that the entire school should be educated. A little unclear.
Well, yes and no. I mean, on any student with any health concern, whether it's sickle cell or any other health problem, whoever may be in contact with that student should know that, you know, the to care for the student, to keep the student safe and healthy in the school setting. So if someone's going on a field trip, depending on what the field trip is, you're going to have to determine who needs to know.
Okay.
Is that helpful to you?
Yes, that answers it perfectly. Thank you.
Yeah. That's a great question. Thank you. Any other questions? Okay. Well, thank you all. This webinar has been recorded and it will be available on our website, so that if any of your colleagues in your local school health programs are not able to attend, they may be able to access it on our website. So thank you very much.
Thank you. Thank you.
Yeah, Megan put that, yeah.
All right, so I can stop recording.
Mm-hmm.